Alright guys, so here's a little video I'm going to put together for explaining recurrent corneal erosion syndrome and what that means and how I managed to get through it. I might take off my glasses, I can't see anything, but I guess I don't need to anyway. That's all good. So my name is Ben. I am, I guess I'm qualified to talk about this because I've had it and I've treated it and I've pretty much got rid of it, which has been unbelievably amazing, because this is a really horrible condition to have, and like lots of eye conditions, very hard to treat, and it's quite often there's no treatment for it. And so what do you do when you go through the Western medicine process and try other things and nothing was really working? Just a quick background into me. I live in Perth in West Australia, and I am a qualified acupuncturist and a nutritionist, and I have a master's in Chinese herbal medicine. So that's mainly what I do, is Chinese medicine and nutrition. They're both super cool and very important to me. So recurrent corneal erosion syndrome, let me just explain that quickly. It's an eye condition, and your cornea is the clear front part of your eye. And what happens with this condition is that you basically, when you go to sleep at night, you've got your eyes closed, obviously, and your eyelid sticks to the cornea, the clear front part of your eye. And when you're dreaming, lots going on in your brain, your eyes actually move. So your eyelid's closed, they're sticking to the cornea, and then when your eyelids flutter and move, you tear a hole in the cornea. And it's incredibly painful. I wake up with this blinding pain in my eye. It feels like someone stabbed you in the eye with a knife or something. And immediately you'll start tearing and you get a lot of redness, and you literally can't open your eye. And a small one, it's just very irritating. On a bad erosion, I'm like blind for 2 days and I can't get out of bed. I just have to lie there in the dark and wait for the thing to heal. The eyes heal quite quickly, which is good, but having to deal with this thing is not fun at all. So I went to an ophthalmologist, and he said, this is what you've got. This is unfortunate. So the treatment for this is that we laser the whole of the cornea off. We completely remove it with a laser, and then we grow back, and hopefully magically it doesn't happen again. And I wasn't really that pleased about that. I didn't really want to have surgery on my eye, and there's no guarantee you're not going to get it back. So I thought, no, not really. So I needed something else to come up with, and I did a lot of research online. Of course, there isn't really that much. People have got a few different tips, and some of the bigger health organisations have some very mediocre information that doesn't really help. So what my ophthalmologist said for me to do is to start using Polyvis in my eye before I go to sleep. So before I go to sleep every night, Polyvis is it's a little clear eye ointment tube, and it's a lubricating gel basically. So I've got to pull down the bottom eyelid and put a whole stream of this thing in the eye, close the eye and go to bed. And that provides some lubrication to stop the lid from sticking. And that works quite well. But he said, you've got to do this for 8 months to a year. And when you're really in trouble, this doesn't work anymore. So if that helps you, then brilliant, but that's not getting to the cause of the problem, and this is just really applying a band-aid. But sometimes there's no other treatment. If you're not going to have surgery, there's, what else are you going to do? So I started using this, and it did work quite well. And you run out after a month or whatever, and you've got to go and buy it again, and then you buy it again, and then I realised I'm going to need 2 tubes, so I'll get the special deal, and I'll buy 2 tubes at once, and then I'll go through that, and then I have to buy it again, another 2 tubes, and I bought another single, and then I was like, what the hell is going on here? This is helping, but it's not curing the problem. And I'm going to have to keep using this over and over and over and over and over and never really get the result. In case you're wondering what this is made from, this is paraffin and lamb's wool fat. So probably not something great that you want to use in your eye for the rest of your life and always have this problem. Because the corneal erosions, when it's bad, I can't see patients anymore. I can't get out of bed. So I can't go into sunlight. And anyone that's had this problem knows that this is a real issue, and it's incredibly painful, and it's very soul crushing, because you've got a lot of fear, I do anyway, about going to sleep and thinking, oh my God, am I going to wake up the next morning with this erosion or not? So there's a lot of fear that you've got to you got to try and get over. So anyway, after using this for like 8 months, I needed to come up with a better solution than that. So I posted it onto one of my Facebook groups, and this very interesting and amazing guy called Andy Rosenfab, who runs a Chinese medicine clinic in America in somewhere. And all he does is treat eye conditions. And so when I told him about this, he didn't really have a lot of solutions for me because it's a difficult thing to treat and he didn't see it that often. But what he did suggest that I try instead of that is that, you've got a problem with lubrication. So maybe instead of doing that, you use coconut oil, unrefined organic coconut oil. So that's what I did. And that actually works equally as good, probably better. I thought that was quite good advice that he gave me. So what I would do for that is that when I go to bed, last thing I do before I try and go to sleep is I'd get a bit of that coconut oil and I would close my eye and I would just rub it over the lid and get plenty on there and put a bit around the rest of the eye and just really put plenty of oil around that eye. And that also helped stop the erosion, so I didn't have a problem. But again, it wasn't curing it. So, I was looking for some more interesting ways of treating this and trying to get to the nuts and bolts of it. So I went back to my acupuncturist and started taking herbs. And that was really, really good. It was really powerful. And it helped me a lot. It got it from, probably 85% better. So I was still getting erosions, but they were very, very small. And they're treating the underlying, one of the things about Chinese medicine is you treat the underlying cause, you don't necessarily treat the symptoms. So with eye problems, it's a lot to do with the liver channel, the gan in Mandarin. And you treat that, and you treat some kidney deficiency and whatever else that the individual has going on. And that's how you actually help them get better. So he gave me acupuncture, distal points on my feet and my hands and some around the eye actually. And he put me on some herbs. So I was treating it internally and externally. Acupuncture kind of does both, and herbs, you're basically treating it internally. So that was really, really good, but it didn't cure it. And I went to him for 6 weeks or 8 weeks or however long it was. I still go and see him periodically because that certainly helped me a lot. But again, I'm looking for a cure. I don't want to have to keep maintaining this. I want to know why is my eye not able to produce fluid like it used to? Because I only had the problem in the left eye. The right eye seems fine, but I wasn't born with this, and I've only been having this now for about two and a half years or something. Started in it was end of 2018. I remember being at the markets one Saturday morning, and it felt like something had flown into my eye, and it was weeping a lot, and there was a lot of tearing, and it was very painful. And that was kind of the first time that I'd had this problem with the eye, and I couldn't work out what it was because nothing had flew into my eye. It just felt like that. And that's what happens when the cornea, if you've ever had a scratch on the front of the cornea, it's the same kind of thing. You can't really see, your eye goes really red, it's painful, it's uncomfortable. It's pretty raw deal, actually. So anyway, the acupuncture was good, the coconut oil was good, but that didn't cure it. And I'm looking for a cure, that's the point. Or at least, can it be cured? Because when I was reading, they were like, well, we don't know how to cure it. There is no cure. You're just going to manage the symptoms as best you can. But I'm also a practitioner, so I want to look at this a bit more holistically and go, what is it going wrong with my body that isn't able to, heal this naturally? If you cut yourself, you heal. If you burn yourself, you heal. So why am I consistently having these erosions? And as it turns out, the cornea, the clear part of your eye, what it basically is collagen. It's a collagen, which is a type of protein. And for whatever reason, that wasn't strong in me anymore. It's partly because I have this condition called Marfan syndrome, which also is an inability to make collagen, but I wasn't getting it in my right eye. And I didn't have this all my life. So something has gone wrong with my ability to heal that started this to occur. And I follow a very interesting guy called Jimmy Yen, who's one of my mentors, that teaches about acupuncture training and business and all these kind of things. And he talked about the nutrition that he did in his clinic, and he said that he follows a guy called Hiromi Shinya, Dr. Hiromi Shinya, who's a Japanese gastroenterologist, and got some very interesting things to say about nutrition, very, very old school. I think he's still around. He's probably about 86 now, 87. And he talks a lot about enzymes. And so I looked him up and I bought his books. This is the first one that he's got. It's called The Enzyme Factor, and it's brilliant. It's very, very old school, and he's talking about how important enzymes are, diet for the future that will prevent heart disease, cure cancer, and stop type 2 diabetes. So you're making some pretty big claims, but this guy's been around for an awfully long time, and he has some brilliant things to say about enzymes. And he says that that's a big factor. Running out of enzymes or not having enough enzymes allows your body to heal. And if you don't have enough, then you can't heal. That's basically what he's saying. He's got another book which I bought, it's called the Enzyme Factor 2. Now, I'm not here to plug him, I'm just telling you that this was some good information that I got. And the third one that he did was, I think he's got about 4 or 5 books. The Enzyme Rejuvenator, that was pretty awesome too. That's a bit more technical. These are written for lay people. They're not designed for practitioners with a lot of knowledge and experience. But he had some really interesting things to say. And one thing he started to talk about a lot was cow's milk and dairy, and how damaging this is for the body and how many systemic health problems this causes. Now, I didn't really want to hear that because I quite like cow's milk and drink a lot of it as a vegetarian, right? A lot of butter, a lot of cheese, a lot of milk, a lot of yogurt, all that kind of thing. It's meat for me. But I started to think that maybe, something I'm doing in my diet is stopping my ability to heal. So after reading his stuff and kind of going, okay, he's clearly onto something here. I'm going to try this out. I'm going to stop the dairy, so no more milk in the coffee, right? Got to drink black coffee, not that bad. You get used to it pretty quickly, and then it's fine. Or you use oat milk or whatever. And for me, that works quite a run. So I stopped the milk in the coffee, and I cut back on the cheese and the butter and all those kind of other things that I was having, and I started taking enzymes, digestive enzymes. I increased my fluid intake, because when you think about the eye getting dry and the cornea, the lid sticking to the cornea, you've got to think about your fluid metabolism and why, maybe if you're not having enough fluids, then you're not going to actually be able to have enough lubrication going to the eye. So these are the things that I started to look at. Getting rid of the dairy, that's super important, causes lots of problems. Increasing the water intake, simple stuff, right? Obvious things that no one ever suggested that I try. I can't believe it took me that long to work out, but that's okay. It did take me a while, but here we are. And the other thing that he talked a lot about was about supplementing with enzymes. Now, I studied this a lot as a nutritionist, and as far as I'm aware, there's no correlation between digestive enzymes and eye problems that I ever came up with. They brushed over enzymes quite quickly. I remember studying them in biology, chemistry, but I've only ever used them in practice to help people with stomach problems. Right? It never really occurred to me that you need enzymes for every single organ function in the body and to digest carbohydrates and lipids and proteins. Like, everything relies on enzymes. So enzymes don't work as minerals or vitamins. Enzymes are, what they are really is a cofactor, things that allow things to work in the body. So it's a bit like, using CRC or oil on a lock that's not working properly. You put a bit of that on, hey presto, things start working again. So enzymes are needed to absorb carbs, lipids and proteins. They're also needed for every single organ in the body to function properly, whether it's your heart or your pancreas or your spleen or your thymus or your stomach or your lungs or whatever. Some organs make enzymes, but the main one that produces most of the enzymes in the body is the pancreas. It produces digestive enzymes, very alkalizing enzymes, to basically get the body to digest food properly and carry out lots of different metabolic functions. So I thought, okay, well, I can try taking digestive enzymes. Probably won't really help me very much, but I don't know, I'll give it a try. So I got some because I am a practitioner and I have these in the clinic anyway. This is the one that I use. So again, I'm not plugging this. This is just a good quality one. It's a practitioner-only brand that we have in Australia, Bioceuticals and Metagenics. These are the 2 main ones that I use in clinic. And this is a very stock standard, just a normal digestive enzyme. It's nothing really special. This has quite a few different things in it though. It's not just enzymes. So amylase are the enzyme that break down carbohydrate, proteases break down protein, and lipase breaks down lipid or fat. And it's got a couple of other things in there. One of them is bromelain, which is actually the enzyme from pineapple that has an anti-inflammatory effect. So I started taking these, and all I did was I had 2 of them at night. I stopped the herbs by this time, the Chinese herbs. I wasn't really doing anything else apart from cutting out the dairy, increasing the water, and starting taking the enzymes. Now, you usually take enzymes with food, but I thought, for me, the problem is at night when I'm sleeping, so I want a bit of extra enzyme in my body and see whether that can actually heal the eye or have some effect on the eye, so I'm not waking up with this kind of blinding pain. Now, I'm giving my story here about how this managed to help me, because it did almost immediately. I've gone now 3 months without a problem. I don't use oil on my eye anymore, no coconut oil, not the polyviz, I don't use any of that. And I still do take enzymes. I do that every night before I go to bed, I take 2 of them. And for me, that's worked brilliantly. So really, I wanted to share, if you've got this or you know someone that's got this and they're not getting any other help, these are the things that work for me, and they're worth trying for you. Now, let me just revise that. So that's increasing your water intake. That's pretty important. Get rid of the dairy. Milk is not your friend, right? Milk's brilliant if you're a baby cow. If you're not a calf, or if you're not a baby cow, you might not want to drink that. And the reason why is it such a problem? Because when they heat treat it, when they pasteurize it, they kill all the enzymes, right? So that's the problem. It becomes a dead food and it causes lots of issues. Milk, the casein protein also is a bit of an issue. It could cause a lot of systemic health issues. And Hiromi Shinya, the guy who wrote all these books, he says that very, very clearly and very explicitly. And then I'm just about to finish another book, which you may or may not have heard of, called the China Study. Here's the biggest study done on nutrition in human history. Went for 27 years, and he's really saying the same thing. You can get this and check it out if you want, but basically it's saying cow's milk is a problem. It causes lots of health issues, and you should probably get off it if you want to improve your health, because it's very hard to do that if you're having lots of dairy. That is a real problem. Cow's milk in particular. So cheese, butter, cream, milk, at least back it off a bit and try and reduce it to allow your body to heal. So the other thing that I didn't mention at the start, which is worth it, is about inflammation in the body and carbohydrates, refined carbohydrates. So this is the other thing that I noticed triggered my corneal erosion, is that when I had these foods, I was much, much more likely to have an erosion during the night or first thing in the morning. For me, it was always about 3 o'clock in the morning, 4 o'clock in the morning. That's when the pain hit, and when my eye, and I woke up in pain, that's when I would get the erosions. So, and there was a dietary factor there, and carbohydrates were a culprit. So if you're having lots of white rice or white pasta or whatever, any refined grains, that is a problem, and you need to get that out of your diet. So get rid of the carbs, get rid of the refined grains. Refined carbohydrates is what I'm talking about. You increase your water, you get rid of dairy, and you start taking enzymes. And for me, those 4 things have been genius and worked really, really well. So I wanted to share this because if you're dealing with this, or if you know someone who is and they're not getting help from anyone else, this is valuable knowledge and it's worth knowing. And I'm going to cover this a bit more because it is a big topic, but there is different ways that you can treat the body and health, and eye stuff is particularly difficult to treat, but for me that works, and if you've got this, it might be worth trying that. So if you've got any comments or questions, by all means leave me a comment. You can Google me. Ben Latto O'Brien is my name. There'll be links in and around this video, so hopefully this helps, and if you have any questions, reach out. I'm just sharing what worked for me, and good luck with your visual health. Hope you improve.